Hi, my name is Bob Baruchim, and I'm the co-director of the Fellowship in Male Sexual Health and Male Infertility at Lenox Hospital. I work together with Drs. Francois Eid and Harris Nagler, and together we're very proud of the program that we've built here. I'm sure that Dr. Nagler and Dr. Eid are going to speak about their own clinical experience at length with you on this video. Just for you to understand, in terms of our clinical experience, we have a very robust volume in terms of the management of male fertility, with a significant microsurgical case volume, primarily focused in varicocelectomies, microdissection, testicular sperm extractions, and occasional vasectomy reversals. In addition, we have a very robust volume of penile prostheses and specialize in the management of erectile dysfunction and Peyronies disease. The office-based volume here will truly help to round you out as a clinician and get you to be efficient and effective in the management of patients presenting with these different conditions. One of the nice things about our program is the implant volume. Dr. Eid, as you probably already know, is one of the more prolific implanters in the United States. He focuses in a penoscrotal approach to this operation. I also do a relatively healthy volume of penile prosthesis, which would be performed through an infrapubic approach. And so, you know, the fellow truly gets a very strong understanding of that anatomy, in addition to the microsurgical experience and to the medical management of these conditions. We hope to meet you at any time. Please feel free to reach out to us, and hopefully we can work together in the coming future.
Hi, my name is Francois Eid. I'm co-director of our fellowship program with Dr. Bobby Baruchim. First, I want to thank you for looking at our fellowship. It's a very new fellowship. It's sort of a blended fellowship where I'm in private practice and Dr. Baruchim is a full-time employee of Northwell Urology Department, which is, I believe, one of the strengths of our fellowship, where you get experience both seeing what a private practice office works and how an academic practice as well. Divide our time between treatment of male erectile dysfunction and infertility. We also have Dr. Harris Nagler, who is an authority in the treatment of infertility. Dr. Nagler used to be the chief of urology at Beth Israel Hospital downtown, and now he's part of our program as well. So he's a very valuable source of information and has a tremendous experience in the field. The great thing about the fellowship as well is that it's new. So there is a lot of flexibility to design your own schedule and spend time in different locations. We operate at Manhattan Eye, Ear, Nose and Throat, which is a fabulous facility. It's used to be a hospital, which is part of Lenox Hill Northwell Health. Very well run, very efficient. The time between surgeries is small. We don't operate late. Patients don't spend the night there. It's purely an outpatient facility. We also have outpatient facility at Lenox Hill Hospital, which is on 77th Street between Park and Lexington. Also a nice hospital, smaller than these big institutions. Again, turnover time is short and brief and efficient. I have a block time 2 days a week, every Tuesday and every Friday. We usually do 3 cases every day, and block time at Lenox Hill on Wednesdays, every other Wednesday. And we do the sicker patients there, patients with heart transplants, liver transplants, and so forth, that may require hospitalization after a penile implant, but we rarely keep patients in-house. I perform penile implants with the penoscrotal approach. Dr. Baruchim does the infrapubic approach, so you learn really how to do both ways. The volume of implants that you would get by coming here would be very vast. You can count on around between 250 to 300 penile implants experience. Dr. Baruchim and Dr. Nagler, they are very experienced. Dr. Baruchim is a fellowship trained doctor, both at Memorial Sloan Kettering and New York Presbyterian Cornell. So he's had a very robust experience in both infertility and the treatment of erectile dysfunction. Dr. Nagler, most of his practice is office-based and surgical for male infertility. I find that the Department of Urology here at Northwell is extremely friendly. We have a terrific director and chief of department, Dr. Lee Ridgetown. The atmosphere between the residents and the fellow is very good. There's no arguing for cases. There are enough cases for everyone. Please feel free to contact us if you have any additional information. We hope that this video is helpful in introducing our fellowship. And again, I want to thank you for taking the time to look at it. Thank you.
Good morning. I'm Dr. Harris Nagler. I am a urologist. I'm a member of the Department of Urology at the Lenox Hill Hospital, part of Northwell Health. I'm also proud to be a member of the faculty of our fellowship for male reproductive medicine. I've been doing reproductive medicine for many years. I previously was a departmental chair, program director, and president of a hospital. I've had various leadership roles in the societies that deal with male reproduction for many years. I work with Dr. Bobby Barucham and Dr. Francois Eid to make sure that this is a wonderful training program. Although it's a new training program, we are evolving and developing quickly. It'll be our pleasure to have the opportunity to work with you and be mentors for you. So if you have any questions, please feel free to reach us.
Morning, my name is Carlos Melika. I am the clinical fellow in male sexual health and fertility program at Lenox Hill Hospital. I found out about the program from the Society of Sexual Medicine of North America. I started August 2nd in 2021.
Okay.
So I work at Lenox Hill Hospital. I work at Meath, Manhattan Ear and Eye Throat Hospital. And I work also in with Dr. Eid in his office in York Avenue and 63rd Street. And I work with Dr. Barucham in his office and with Dr. Nagler in his office in 2nd Avenue and 54th Street. I'm spending one day with Dr. Eid in his office and one day with Dr. Eid helping him in the OR. I'm spending one day with Dr. Barucham in his office and one day with Dr. Barucham in the OR and one day with Dr. Nagler. The good thing in the andrology fellowship or in the andrology specialty as all is a good mix between spending hours in the OR and spending time in the office treating the patient, and I had a very good experience helping Dr. Eid in the OR. Dr. Eid works with all the penile implant companies, and he does like virgin cases and he does redo cases. He does very complex cases. So Dr. Eid uses the penoscrotal approach and he uses the non-touch technique. Dr. Barucham does both infertility and male sexual health. Being with Dr. Barucham is very good experience because I had the opportunity to help him in the office procedures like testicular sperm extraction, the office vasectomy, and also I'm helping him in the OR doing the penile prosthesis via the infrapubic approach, and also the microsurgical cases like microsurgical varicocelectomy. Dr. Nagler also does the infertility procedures, microscopic procedures, microscopic varicocelectomy, microscopic testicular sperm extraction, doing the penile Doppler and the injection therapy for erectile dysfunction, and Xiaflex injection for treatment of Peyronies disease. The salary is fair. It's the PGY6 salary. Overall, the atmosphere of this fellowship is very healthy, and I enjoy working with the nurses and the residents. There's a lot of autonomy, and people are helpful and supportive, and I feel this is very important because at the end, working in a healthy environment benefits the patient at the end.